I'm Andreas Götte. I'm professor of medicine and chief of the Department of Cardiology and Intensive Care Medicine at the St. Vincenz Hospital in Paderborn in Germany. We do have about 8,000 in-house patients a year. So we are a whole group of cardiologists encompassing 16 physicians who actually work in this field, plus residents and fellows. So we cover all different cardiology technologies and techniques. And of course, to treat patients with coronary artery disease is one of our cornerstones of in-house patient therapy. So usually we do have to have a very short time period to do all diagnostic tests. And we do know from the latest guidelines that a treadmill test is not appropriate for ischemic assessment. So for this reason, of course, we do need imaging technologies like CT or echo or MRI, which are not unique available in this large volume of patients. So for this reason, I think it's very nice to have a new technology to actually get rid of patients who do not have coronary artery disease. And for this reason, I think the CADScor system doing a non-invasive technology is very helpful to rule out the presence of sclerosis of the coronary arteries in patients who come in with atypical angina pectoris or just chest pain, where you need to rule out that something is wrong on the coronary arteries. Well, I think the CADScor system is very useful, in particular in patients with a low risk profile, where you do have a low risk for coronary artery disease. So in patients with already established coronary artery disease or elderly patients with a long list of concomitant diseases, the discrimination with the CADScor might not be so good to use it in a clinical routine. However, if you have a young patient with a low risk profile for coronary artery disease, I think the system is extremely helpful to rule out with a high percentage that there is no pathology on the coronary arteries. And this is the main cohort of patients where we actually use the CADScor system routinely. It's very easy to use. You just need 4 times 8 seconds of non-breathing, and you can assess the flow in the coronary arteries. So I think it's very helpful to be used in patients where you want to rule out the presence of coronary artery disease or coronary artery sclerosis. You need to have easy technologies which are very helpful to demonstrate that the disease is present or to rule out